In this video, I'm going to explain everything you need to know about Lisinopril, especially what it does to the body and about specific side effects. This is especially important if you're about to start Lisinopril or you're already established on it. I'm also going to answer 3 frequently asked questions in my clinics. Why have I started to get a dry, tickly cough? Why have I started to feel dizzy and lightheaded? What are the long-term side effects? These are really important questions that you should be fully informed about when making a decision about taking any medication. This video will help you to understand more about Lisinopril and allow you to make a logical decision about taking it. So let's get started. So what is Lisinopril and how does it work? Lisinopril is a medicine to treat high blood pressure and heart failure. It's also usually prescribed after a heart attack to prevent future strokes and heart attacks. It is also used in diabetic kidney disease. It helps to protect your kidneys and slows down the disease. It does this by reducing the amount of protein you lose through your kidneys and by reducing high blood pressure. Lisinopril is a type of medicine called an angiotensin converting enzyme inhibitor, ACE inhibitors for short, and I'll be using this term for the rest of the video. Like other ACE inhibitors, Lisinopril relaxes and widens the blood vessels. This lowers your blood pressure and makes it easier for your heart to pump blood around your body. This can improve the symptoms of heart failure also. So what is the correct dose? The dose of Lisinopril you take depends on why you need the medicine. To decide your dose, your healthcare provider will check your blood pressure. You may also have blood tests to check how well your kidneys are working and the amount of potassium in your blood. You'll probably be prescribed a low dose of Lisinopril at first, so it does not make you feel dizzy. This will usually be increased gradually until you reach the right dose for you. Depending on why you're taking Lisinopril, the usual starting dose for adults is between 2.5 milligrams and 10 milligrams once a day. This will be increased gradually over a few weeks to the usual dose for your condition. So for example, for high blood pressure, it's usually 20 milligrams once a day to a maximum of 80 milligrams once a day. After a recent heart attack, it's 10 milligrams once a day. For heart failure, it's usually 5 milligrams to 35 milligrams once a day. And for diabetic kidney disease, it's 10 milligrams to 20 milligrams once a day. So how do you take it? You'll usually take Lisinopril once a day. It may be better that you take your first dose before bedtime because it can make you feel dizzy. After the very first dose, you can take Lisinopril at any time of the day. Try to take it at the same time every day. You can take Lisinopril with or without food. Swallow Lisinopril tablets whole with a drink of water. Lisinopril usually starts to work within a few hours to reduce high blood pressure, but it may take a few weeks for it to take the full effect. If you're taking Lisinopril for heart failure, it may take weeks, even months before you feel better. So how long do you take it for? Now, after a heart attack, you usually take Lisinopril for 6 weeks. Your doctor will then decide if you need to keep taking it for longer. For high blood pressure, heart failure, and diabetic kidney disease, treatment with Lisinopril is usually long-term, even for the rest of your life. So is there any food or drink you need to avoid? Do not use salt substitutes such as low salt. This is because they're high in potassium. When they are mixed with Lisinopril, they may make the level of potassium in your blood too high. Drinking alcohol can increase the blood pressure lowering effect of Lisinopril, which can make you feel dizzy or lightheaded. During the first few days of taking Lisinopril or after increasing the dose, stop drinking alcohol until you see how the medicine affects you. If Lisinopril makes you feel dizzy, it's best to stop drinking alcohol while you're taking it. So what should you do if you get ill while taking it? Contact your healthcare provider if you get ill, such as a high temperature, sweats and shaking, or severe diarrhea or vomiting. Your doctor may advise you to stop taking Lisinopril until you recover and are eating and drinking normally. These are called the sick day rules that are applied when you get ill taking certain medication. I will provide a link below for further information. So who can take lisinopril? Most adults and children aged 6 years and over can take lisinopril. If you have diabetes, check your blood sugar glucose more often, particularly in the first few weeks. This is because lisinopril can lower the sugar level in your blood. So who may not be able to take lisinopril? Lisinopril is not suitable for some people. To make sure it's safe for you, tell your doctor if you have ever had an allergic reaction to lisinopril or any other medication. You are trying to get pregnant, are already pregnant or breastfeeding. If you are having dialysis or any other type of blood filtration. If you have heart, liver or kidney problems. If you have unstable or low blood pressure. If you have diabetes. If you are going to have a major operation such as surgery or general anesthetic to put you to sleep. If you have recently had diarrhea or vomiting. If you are on a low-salt diet. If you are going to have a desensitization treatment to reduce your allergy to insect stings. If you have a blood problem such as low white blood cell count. So what are the common side effects? Common side effects include a dry, tickly cough that does not get better, feeling dizzy or lightheaded, especially when you stand up or sit up quickly, headaches, being sick, diarrhea, itching or a mild skin rash, blurred vision. So what are the serious side effects? Call your doctor or emergency services if the whites of your eyes turn yellow or your skin turns yellow. This can be a sign of liver problems. If you're paler than usual, feel tired, faint or dizzy, have any sign of bleeding, for example bleeding from the gums or bruising more easily than usual, or a sore throat, a fever, or if you get infections more easily, these can be signs of a blood or bone marrow disorder. If you have severe stomach pain, this can be a sign of an inflamed pancreas. If you have swollen ankles or blood in your pee or you're not peeing at all, these can be signs of kidney problems. You have weakness on one side of your body, trouble speaking or thinking, loss of balance or blurred eyesight. These can be signs of a stroke. You have a faster heart rate, chest pain and tightness in your chest. These can be signs of heart problems. You have shortness of breath, wheezing and tightening of the chest. These can be signs of lung problems. In rare cases, it's possible to have a serious allergic reaction to lisinopril. These are not all the side effects of lisinopril. For a full list, see the leaflet inside your medicines packet. So what about taking lisinopril with other medicines? There are some medicines that may affect the way lisinopril works. So tell your healthcare provider if you're taking any of these medicines. Anti-inflammatory medicines such as ibuprofen, indomethacin or aspirin for pain relief. Medicines to treat low blood pressure, heart failure, asthma or allergies such as ephedrine, noradrenaline or adrenaline. Medicines to treat high blood pressure such as aliskiren. Other medicines that lower your blood pressure such as some antidepressants, nitrates, baclofen, anesthetics, or medicines for an enlarged prostate gland. Medicines that calm down your immune system, such as cyclosporin or tacrolimus. Medicines that make you pee more, such as furosemide. Medicines that can increase the amount of potassium in your blood, such as spironolactone, triamterene, amiloride, potassium supplements, trimethoprim or heparin. Steroid medicines such as prednisolone, allopurinol, procainamide, medicines for diabetes, Zestril or lithium. The 3 most commonly asked questions. The first question I get asked is, why have I started to get a dry, tickly cough? Having a dry, tickly cough is a common side effect of ACE inhibitors such as lisinopril, and you will find that the cough medicines do not usually help for the cough. Although the exact mechanism of ACE inhibitor-induced cough remains unclear, several theories have been proposed for the cough development. One theory is that ACE inhibitors break down certain proteins, and the accumulation of these byproducts of those proteins can cause the cough in the upper and lower respiratory tracts. If this is the case, healthcare providers usually ask patients to stop taking the lisinopril to see if the cough improves, and this can take up to 4 weeks. I would recommend discussing any unexplained cough after starting lisinopril, especially if it bothers you or stops you sleeping, as another medicine may be better. So the second most common question asked is about feeling dizzy or lightheaded, especially when patients stand up or sit up quickly. The dizziness may be due to the blood pressure lowering effect of lisinopril. This is more likely to happen when you start taking lisinopril or you move onto a higher dose. If lisinopril makes you feel dizzy when you stand up, try getting up very slowly or stay sitting down until you feel better. If you begin to feel dizzy, lie down so you do not faint, then sit until you feel better. That's why it is recommended to take your dose at bedtime if this keeps on happening. Do not drive, ride a bike, or operate tools or machinery until the dizziness passes. And lastly, I am asked if there are any long-term effects with taking lisinopril. Taking lisinopril for a long time can sometimes cause your kidneys to not work as well as they should. The long-term use of these drugs has been shown to be associated with hardening of the kidney vessels. This is the reason why your healthcare provider will check how well your kidneys are working with regular blood tests. These are usually performed at least once a year as a minimum requirement. I will provide any links to the studies below. How can you help to lower your blood pressure naturally? I will go through this in more detail in another video, but you can boost your heart health and make some key lifestyle changes that will help your blood pressure. So start today by making dietary changes, quitting smoking, lessen your alcohol intake, reduce stress levels, get better sleep, manage your weight, get regular sunlight, correct your balance of sodium-potassium intake, keep your body's insulin low, increase physical activity, look at breathing techniques such as breathing through your nose rather than your mouth, and lastly, supplementation with micronutrients. Now, if you've enjoyed this video, please remember to hit the like button and hit the subscribe button if you'd like to see new videos that are posted every week. And hit the notification bell if you want to get notified about new videos. And please make a comment in the comment section to tell me what you enjoyed about this video or what topics you'd like to learn more about. You can also check out my other videos on atorvastatin and amlodipine.